Hi, this is Ginger Garner. Welcome to our practical potty meditation. We're going to spend just a few minutes helping you improve your digestion. If you have any constipation or have ever had issues with that at all, this meditation is for you. You don't need very much equipment, but you will need a few things to get started. First is a toilet, or anywhere where you can eliminate that is legal. Second, a warm washcloth handy would be really helpful. Third, your breathing. Fourth, a quiet place that you can relax or is at least conducive to relaxation. And the last thing, either a squatty potty or anything that allows you to get your knees above your hips while sitting on the toilet. For a lot of people, it's just simply a few yoga blocks. You don't have to have anything fancy to make this successful. And that's it. You're ready to go. First, it's important to understand why constipation can happen. Sometimes it's a lack of hydration or fiber, and sometimes it is because the pelvic floor is tight or clenched or spasming. And if it is, it's nearly impossible to go to the bathroom correctly. So if you're hydrating, which is at least approximately half of your body weight in pounds, so half of the body weight in pounds in ounces. So if you weigh 120 pounds, then you need about 60 ounces of water a day. So first, make sure you're getting enough hydration, enough water, which does not include caffeine. Second, make sure you're getting enough fiber. A quick search online will give you those fiber guidelines. And then third, let's make sure the pelvic floor is at ease. Bringing your knees above your hips is the first big thing you can do for yourself. That releases a muscle called the puborectalis and the other muscles of the pelvic floor so that you can go to the bathroom. Next, let's focus on your breath. But before we get started, you want to take that warm cloth while it's still warm and either rest it on the pelvic floor or you can do a wipe of a front to back. I prefer just having you rest the warm towel on the pelvic floor, and it's here where we'll do our first breathing meditation. Exhale completely, and on the inhale, holding that warm cloth against the perineum, against the pelvic floor, which includes everything from front to back, from the very front of the pubic bone all the way back to the rectum. As you inhale, I'd like for you to feel the skin over the pelvic floor, right where your hand is, kind of descend as you take an inhale. And that's because your diaphragm presses your abdominal contents down, and your abdominal contents press your pelvic floor down. That all happens on your inhale. Second, if it's hard to feel that, you might be using a breath pattern that is going against pelvic floor relaxation. So you can have one hand on the pelvic floor holding that warm cloth there, and you have the other hand around your throat and chest. And when you inhale, you want to make sure your throat and chest stay calm and at ease, no tightness. Because if you clench there, around your voice and throat area, likely you're also clenching the pelvic floor. So I want you to drop the root of your tongue, so the very back of your tongue, drop the jaw and put some space between your teeth, and see if you can get your airway and your throat to loosen up. As you inhale, that's what you'll do. Drop the tongue, drop some space between the teeth. Feel the pelvic floor descend into your hand. Feel the abdomen expand when you inhale. And then on the exhale, everything returns to a gentle, steady position. I call it steady state. Our goal is to at least inhale to a count of 4 And exhale to a count of 6. One way you can lengthen your exhale out is to make a slight sound. Exhale. Sometimes this helps relax the pelvic floor even more. Inhale again. Feel the pelvic floor descend. And exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6, 7, 8. One more time, inhale. Feel that the throat and hopefully the vocal area and the neck is relaxed. And exhale. A longer exhale than your inhale. Now, as you get better, you'll be able to make your inhale longer. We'll shoot for a goal of an inhale for 6 to 8 counts. Very slow. And a goal of 6 to 8 counts on your exhale. This will get you to around 4 to 5 breaths per minute, which would be your goal. Now let's add one more trick to improving your digestion and elimination. On your inhale, you're going to reach back with your fingertips to the very center of the back of your glute, your gluteus maximus, or right in the middle of one side of your butt. Right in the middle of your bottom back there, there's usually a little tender point if you're constipated. I want you to find that little tender point in the middle of your bottom and then do 5 circles on your exhale, 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 and then 5 circles in the other direction on the exhale, exhale, exhale. And see if you can visualize the pelvic floor dropping and expanding and relaxing even more. And then on your next breath, you may need a couple of repetitions to do that. Switch into the other side, right in the middle of the glute, in your bottom. 5 circles in one direction, massaging, and 5 circles in the other direction, massaging. And there's one other point that can help digestion. It's right in the middle of your calf muscles. So reach down, which you can do if you're sitting on the toilet and your knees are higher than your hips. Reach right into the middle of your calf. See if you can find a tender point there. And I want you to do the same massage. 5 circles, staying over the muscle. Don't just slide your hands over the skin. Keep your thumb or whatever you're using firmly in the muscle. Then move the muscle around rather than just moving the fingers over the skin. Once you do 5 times in each direction, switch into the other side. Inhale, find the tender point. Slow down your exhale. 5 little massage circles in one direction. Making little circles and 5 in the other direction. And you may need to spend some more time with these 2 acupressure marma points. So these are used in traditional Chinese medicine and Ayurvedic medicine. And these are said to be connected to digestion in the body. So if these help you, wonderful. Feel free to continue on past when this meditation ends, of inhaling expansion, relaxation, and a stretch through the pelvic floor as everything drops, the abdominal contents drop and stretch the perineum, the skin between the openings, if you will, between the front and the back of the pelvis. And exhale, everything returns to a steady, relaxed state. And hopefully this will provide the success you need with improved hydration, improved fiber intake, and improved pelvic floor relaxation to make you feel a whole lot better with regards to digestion and stress and anxiety management.